There are warnings tonight that people are dying of heart attacks and strokes because they're so frightened about catching coronavirus that they're avoiding going to hospital when they should. A consultant at one of England's leading hospitals also expressed concern about the rising numbers of victims of domestic violence and people who have attempted suicide. The latest official figures for the UK show there were 847 deaths reported in the last 24-hour period. It means that the total official number of deaths in the UK linked to coronavirus is 14,576. That number doesn't include deaths in care homes or in the community in England and Northern Ireland. Our health editor Hugh Pym and camerawoman Harriet Bradshaw have been inside Addenbrooke's Hospital in Cambridge to see how they are dealing with the virus.
One hospital's battle against coronavirus.
Many of us have had dark times, but together we've supported each other.
Patients tell us what they're going through.
I'm just in the good hands of the doctors and nurses to do all they can.
And the hidden victims of the COVID crisis.
So some people will die as a consequence of not getting treatment for their heart attack or their stroke.
This is the face you now see at the front door of A&E.
Fantastic. And why are you here?
A triage nurse in full protective equipment. They're not taking any chances.
Pop inside, there's a nurse in green on the left.
Addenbrooke's in Cambridge invited us in to see how the response to coronavirus has transformed every part of the hospital. First in A&E. Normally at this time of the day there are people waiting outside to come into the emergency department, but right now it's empty. It's quite extraordinary. Numbers are down 40% month on month. Doctors fear that patients are staying away because they're worried about getting the virus. Is there potentially quite a lot of damage to people's health as a result of that, do you think?
We don't know yet, but it's likely there are people who are having heart attacks who are then subsequently not getting the treatment they need and could be dying as a consequence of this.
There's a separate red zone in A&E with its own entrance. Here, ambulances arrive with suspected COVID-19 patients. This is much busier. And there are other possible consequences of the lockdown, which bring in more patients. What are you seeing more of in terms of non-COVID cases?
Well, we're seeing a lot more domestic violence. We're seeing quite a lot of alcohol-related problems, and we've seen some fairly nasty suicide attempts. It's early to know whether this is a true reflection of what's going on, but it seems plausible that this is a cause for concern.
To streamline the system, there's a specialist assessment unit for patients with coronavirus symptoms.
If you look at anyone on wearing a full surgical gown, I'm probably more protected from the neck and chest area now.
Matt, who's a consultant, trains colleagues on how to safely use personal protective equipment, including aprons.
So bare below the elbows policy with regards to the arms, but I'm going to clean those afterwards.
This hospital says it has enough protective equipment known as PPE. They provided what we used. We donated our own supplies of PPE in exchange.
Well, you can probably see by my visor fogging that it gets quite hot. It's quite uncomfortable, and you can only do it for a certain period of time.
They change some items several times in a shift. Graham is 83. He wanted to talk to us. His wife, who has coronavirus, is on a different floor of the hospital.
Been married 62 years, and now she's another 66 years. That's a long time. But we get through it. She's a fighter.
Yeah. We will be able to get you to see your wife, okay? Because I know it's really hard for you. So we can get you to see her, but we'll try it all we can. All right.
Okay. Thank you.
All right. So don't worry. If I have to get her on FaceTime, we've got plenty of mobile phones in the hospital, and we'll get you to see her.
We're now entering what we call the pod, which is a 5-bedded area of our intensive care.
The sickest come here to intensive care. Andrew is a consultant and Natalie is a healthcare assistant who helped plan a doubling of critical care beds.
So we're now going to walk in here. So this is a COVID area now. So they're attached to a ventilator through a tube that's going through their mouth into their lungs. And those patients require one-to-one nurse-patient ratios. So we've got a nurse or a physiotherapist by the bed space looking after every patient.
The atmosphere is calm and quiet, but the intensity of the work can take its toll.
It's only by teamwork that we've managed to do it. Many of us have had dark times, but together we've supported each other and we're getting through it, together with the support of the community being absolutely fantastic with their gratitude they're showing us.
Where we're so involved normally with the families and making sure that, you know, we're with them every step, you know, of that end of life process, to all of a sudden now being in that environment where, you know, it's just us with the patient is very difficult. But, you know, what I will say is that, you know, we're always with them, they're never alone. There's always a nurse holding their hand, and we do the best we can.
Nothing in their earlier training has prepared them for this. They know it's now the reality of their working day, and they don't know when it'll end.
Very difficult work for the teams involved, and Hugh is with me now. And the teams you film with do have enough PPE, we saw that in the film. Other hospitals don't, and tonight the government has confirmed new guidelines surrounding PPE.
Yes, Sophie, the reports that some, but by no means all hospitals may run short of gowns or even run out in the next few days. That's gowns for intensive care. So these new guidelines tonight will tell staff that they can reuse some protective equipment if it's laundered, the gowns and other equipment as well, in certain circumstances. Now, the British Medical Association, representing doctors, says this is a dire situation. It's because of government failings to get enough supplies of PPE. The Department of Health and Social Care say there is a global shortage of gowns, but the new guidelines are designed to reassure staff what they can do if they do run short, and they have been supported by the Health and Safety Executive.
And we saw in your film as well the emotional pressure that the people looking after the patients are under.
Yes, the sheer professionalism, the dedication to their patients of NHS staff is really quite moving and very, very impressive to actually see in action. It does take its emotional toll. The other thing that was very striking is the way a hospital like Addenbrooke's and many others have transformed themselves in weeks, creating all these critical care beds. They do have spare capacity at the moment. But what's not happening? Routine operations, procedures, outpatient appointments, all cancelled. We've heard of the long-term health problems that may be being stored up by people not coming into hospital. And the message tonight is very much people need to go into hospital if they need care. So what we don't know is when the NHS will get back to a sort of normal service. It's very hard to answer that question. The situation could go on really for some time yet.
Hugh, thank you.